Hey guys, it's Dr. Greg with Judice Sports and Rehab here again on Friday to answer some of your questions on the shoulder. So this week we got 3 questions, 2 of them serious, real questions, and we got a silly one that we're going to throw in at the end. So the first question this week is from Annie. Annie asks, what are some easy ergonomic adjustments that I can make to my work desk to reduce shoulder pain? Okay. I'm going to specifically answer this one for Annie. So for people that are vertically challenged, a lot of times I see people that try to raise up the chair too high, and then therefore they kind of have to scoot to the edge of the chair to keep their keep their feet down. And so what happens is they're not using their armrests appropriately, they're not using their backrests appropriately. And so what we suggest there, yes, keep your chair higher to keep your arms in a good spot, but get yourself a footstool so that you can sit further back into the chair. That's a big issue that I see pretty frequently, is people are sitting right at the edge of the chair and not able to relax and work efficiently. And what that'll do is kind of decrease some of that shrugging. So if you're not able to use your armrests, a lot of times you'll see people shrugging up and overusing the muscles on the top part of their shoulder. Second thing you can do is keeping those frequently used items, so your mouse, your keyboard, keep it all within a very small area. So not having to reach further out and use that shoulder too much for mouse clicks or typing way out front. So make sure that everything stays pretty close to you so that you're not having to really reach. And so that reaching repetitively can cause some shoulder issues. And then the last thing is getting a keyboard tray. A lot of times that desk, you may have 4 to 6 inches of height between where your legs touch and where the top of the desk is. And what I often see is people want their elbows to be in a good position, so they raise their shoulders so that they can type efficiently. And what that does, again, that shrugging position, overusing some of the muscles on the top of the shoulder. So getting a keyboard tray so that you can keep your arms down and relaxed is oftentimes pretty effective at decreasing some of the stresses to the top of the shoulders. Hopefully that answers your question. If you had something more specific, Annie, you know how to find me. The second question is from Nick. He asks, what are the best exercises to do for a shoulder that wants to pop out of place due to excessive internal rotation? And then which should I avoid? So I have some follow-up questions for that just to see exactly what's going on there. Has there been a prior dislocation, or is this kind of a new thing? Is my first question for Nick. And then my second question is, do you have excessive internal rotation, or does the pop only occur when you're in internal rotation? So for me to be able to fully answer that question, I would need to know the answer to both of those questions. But I will answer it kind of generically here. First thing you need to do is avoiding the extreme stresses at the extremes of motion. So with both full external rotation and full internal rotation, the ball and socket, the ball slides forward within the joint. And so that sliding forward position can put a lot of stress on the front part of the shoulder, especially if you've had a previous dislocation. I'm going to be putting a lot of stress on the front part of the shoulder, and that could cause that popping sensation, or that subluxation, if you will, not a full dislocation, I assume. So avoiding those extremes. So not lifting in this position, try to keep your arms in a neutral position, or not carrying something back here, trying to keep you more in a neutral position. And then again, same thing with internal rotation. We're not lifting something up here. We want to get to a neutral position. Use your body to decrease the stress to the shoulder itself. And then best things to do would be functional weight bearing. So thinking like monkey crawls, bear crawls, planks, push-ups, those motions that are functional daily tasks that you might be doing. and that's meant to stabilize. So I assume if this is happening frequently, that there may be some instability, not that it's falling off by any means, but some instability at the shoulder. So I really want to work on the stability at the shoulder to make sure that that doesn't continue to happen. So neutral position, try to keep it in not the excessives of motion like we talked about. But weight bearing is one of the best ways to get some strength through both the rotator cuff, the pecs, and through the shoulder blade. So all of it has to work together to stabilize you appropriately. And then, Nick, if you have follow-up question to that, or you want to answer my questions to you, please let me know. And then the last one, the silly question here, is from Jessica. She had asked in the elbow section, what would happen if the elbow moved like the shoulder? Well, we have the inverse question today. What if the shoulder moved like the elbow? What motions would be awesome? So I think probably the most efficient movement would be a hammer, because it's going to be a straight down motion. And if you've got two joints that can really hammer that out, then I think that would probably be the most efficient motion if the if the shoulder moved like the elbow. Awesome, guys. I appreciate it. Please continue to ask some more questions. I would love to address those in a couple of weeks. We'll be back next Friday with another live video. Gonna see. I may have a new topic for next week. I don't think we're doing Q&A, but I think a couple of weeks from now we're doing another Q&A. So keep throwing out those questions, and we'll answer them when we do another live. Thanks, guys.